Welcome to Forum 360. I'm Sally Henning. Our special guest today at this time of everyone's concerned with COVID-19 is an expert pulmonary doctor from Stark County, Dr. John Given. Welcome to Forum 360. I should say welcome back to Forum 360, Dr. Given.
Thank you very much. It's great to be here.
Thank you. Let me tell you just a bit, tell our audience just a bit about you. You've been serving the patients of Stark County, I understand, since 1984. You have advanced medical training and board certification in a variety of specialties, not just pulmonary medicine, but internal medicine, allergy, immunology, and sleep medicine. And I understand that you've been involved as a principal investigator in over 200 research studies and clinical trials, and that you're the author of numerous articles, peer-reviewed journals, and you have a staff of what, over 34 employees now, something like that? So we're talking today about the coronavirus, all these viruses, this new world, and what people can do to protect themselves now and next winter. So welcome to Forum 360, and can you tell us?
Thank you. Thank you, Sally. Thank you. I think the first thing I'd like to say is that really, I think our state government in particular, Amy Acton and Governor DeWine have really done a great job for the state, balancing the different issues and putting the safety and well-being of the people of Ohio first and foremost priority.
That's good. Well, what areas do you believe with respect to this COVID virus are the most important to address, to talk about?
Well, I think the most important thing, there are a lot of important things about it. This is the most unusual infectious entity that I suspect other physicians have faced in our generation.
You must be incredibly busy.
Well, it's not so much that I'm busy. I mean, we are, but this is a virus that is just has some very unique features, and we haven't seen a virus of this lethal nature in over 100 years in our country. So it certainly is something that is appropriately capturing the attention, finally, of our federal government. A little late getting on board there, but now that we're on board, the federal government, state governments, every scientist and pharmaceutical company of which I'm aware is working feverishly on this topic.
What people do to assess? You said that the virus is very deadly. What can people do to assess their particular risk?
Right. You know,
the risk of infection.
I'll talk a bit about that, and I think the important thing to start to realize is that there's different risk levels, and we should all, I think, begin understanding that 98% of the COVID virus transmission from one person to another has to involve a virus particle coming from the nasal or bronchial passages of one infected person, traveling in the air and landing on the respiratory passages of another person. And the emphasis sometimes is diverted away from that understanding of the predominant means of transmission, which is respiratory through the air, one person in close proximity to another. You know, we read research about viruses remaining viable on doorknobs and keyboards and pens and traveling great distances in the air. And some of these things have some validity, but they're for the most part, they're sensationalized to gain headlines and publicity. And I think it's important that we always stay close to recognition that this is primarily an infection that is transmitted through close proximity of one infected person to another.
Is that why the masks are so important?
I think the masks are important, and I feel for the average American who hears the news saying, no, masks, no good 1 week, and then next week, yep, everybody should wear a mask. I think they're so much better than nothing. Nothing's perfect, but I think masks are very important. And when two individuals, an infected individual wearing a mask and an uninfected person wearing a mask, the likelihood of transmitting a virus in that setting is very small. And I think we can take some degree of reassurance from that reality. So a person who's has been in lockdown at home, and perhaps they leave the house rarely, and when they do, they wear a mask, and maybe there's one or two other people at home with them. I hope that person goes to bed every night feeling very reassured. They're not gonna catch the virus because they're in an environment where there is no virus. And so for a person of that in that situation, to fret for that person to wash their hands 8 times a day, for that person to worry if they were to develop a minor cough or another symptom, I just would like to say to all those people, take a breath. Your chances are you're okay. You're okay. Healthcare workers, different story. Healthcare workers working in the ICUs and on the floors, different story.
The intensive care units.
Pardon me?
The intensive care units.
And in the ICUs, and I think every hospital now has very strict and I believe effective protocols in place to reduce the risk of transmission to a very, very low frequency. The scary part of this is to consider, as we start to open up society, the asymptomatic carrier. This is an individual who, from external appearance, would seem well, and yet they could be in the early phase carrying enough virus in their nasal and bronchial passageways such that they could potentially infect other people. And we need more information and more time to put that particular topic in perspective. But I think that's a scary thing to contemplate.
That's the reason why schools remain shut, because of the concern that children will be asymptomatic but be exposed.
Yeah. Children and young people are more likely, when they do contract the virus, they're more likely to be asymptomatic carriers or minimally symptomatic carriers. It seems those definitely the elderly, and then other high-risk groups, obesity, asthma, COPD, these people with already a compromised respiratory immunity are the other group. But those people are going to usually identify as being ill pretty early on in the course. Young people could get the virus, have it, walk around, recover, and maybe they wouldn't even know it. So we've got a lot more to learn about the behavior of this virus in our society.
Can we go over that a little bit more? What are you saying are the groups that are the most at risk for this particular virus?
Yeah, the groups that would be most at risk would be those who are delivering care in the nursing homes, and those who are residents in nursing homes, and those healthcare workers who are caring for patients sick enough to require hospitalization. Those are your big risk exposure groups.
So have you done any analysis of whether or not rioters are at a high risk who seem to be self-congregating?
I'm sorry, Sally.
I mentioned rioters. They never seem to get sick. They just seem to be.
No, they
don't. How does that work? I'm sorry. What is the scariest feature of this illness?
I think the scariest feature is that term that I mentioned earlier, the asymptomatic carrier. It's fairly straightforward for someone who develops a fever and a cough and becomes quite ill. And it's quite easy to recognize that person and isolate them, ask them to self-quarantine. But an individual who doesn't know they're ill, who doesn't appear to be ill, and yet may be carrying and spreading the virus in their respiratory air exchange, that's a scary prospect, because how do you rein it in if you can't identify who has it and who doesn't?
Well, one of the things I was wondering about, there's so much talk about respirators, and first the shortage, and now we have lots. How does that work? What is the function of the respirator with respect to someone who's in an ICU?
Yeah.
How does that?
So a respirator is, in simple terms, it takes over the breathing for a patient. A tube is placed in the throat down into the bronchial tubes. For example, it would be placed through the mouth and into the main windpipe. And basically, a ventilator is a fancy air pump. It pumps air in and then lets it come out. It pumps air in and lets it come out. So it really takes over the breathing function of the individual. And it's used in those cases where the amount of mucus, the amount of inflammation in the lung has become so severe that the effort required for breathing is just more than a person can sustain, and so those folks need a machine to take over and supplement. Hopefully, supplement while they recover.
So, how does somebody know what are the symptoms that they would be having that they would then call you or another medical professional? What would they be experiencing? They'd say, I think I have this.
Yes. Well, again, I think we still have a lot to learn, but to prioritize the high points, it would be someone who feels ill, like as if they have they might think I've got the flu or a very bad cold. That's the way that it would start, and following the typical course, over the next several days, there'd be increased coughing, increased nasal congestion, often a loss of the capacity to smell as the nasal passages become progressively clogged. And it's those respiratory symptoms that are central to suspecting the disease.
How about fever?
Of course, I apologize for overlooking that fever. And this is a challenge for someone who might not have a thermometer at home. And so they may feel chilled or warm, and how do they know? So I think as time goes on, I hope everyone will eventually be able to have a thermometer at home so they can accurately measure their body temperature.
You're tuned in today to Forum 360. Our special guest today is Dr. John Given, pulmonary doctor in Stark County. He's also involved with allergies and sleep medicine, and we've just been talking about COVID-19 and what people can do so that they can be healthy now and in the winter. I'm just going to ask you, what are some of the developments that we can expect that will help people to be able to survive and enhance their survivability?
Well, as I mentioned, the amount of resources that have been unleashed to address this epidemic is analogous to a country, a society at war. Every scientist I know, every pharmaceutical company with which I'm familiar, every healthcare institution has this front and center on their priority list. And there's research continuing on medications that would be designed to kill viruses, antiviral medications. Of course, there's over 100 companies working on the development of a vaccine. There are nasal sprays, sanitation devices, air cleaners. I mean, at just about every level, there is an emphasis. The only area where I'm sensing a lack of emphasis will be something that I would like to discuss, and that is to bring out to everyone that in addition to following the guidelines, which I certainly agree with, social distancing, masks, I would like to point out that although mucus is not a favorite topic of many people, it is a favorite topic of mine, and I've observed over the years that prioritizing this mucus layer, which is the respiratory system's first line of defense, prioritizing the integrity and the clearance of mucus in both the nasal and bronchial passages has helped so many asthma and COPD patients under our care that I think this deserves attention in this pandemic situation. Very interesting.
So chicken soup does help.
Pardon me?
So chicken soup does help.
Chicken soup helps.
And the mucus.
You know, when we take note that this virus started in Wuhan, China, during the months of December, January, and February. Well, those are the particularly cold and dry months in this geographical area. And one of the realities of cold outside weather is the need to heat the indoors. Unavoidably, when there's indoor heating, there is dryness, there is a drying of the air, a reduction of the relative humidity, which runs the risk of drying the respiratory mucus layer. And with that drying effect, the ability to clear bacteria, viruses is now compromised, and I believe makes an individual much more susceptible.
Are there other lifestyle aspects that people can work on to enhance their survivability?
Yes, and I'm hoping to be able to reach a wide audience with these simple lifestyle instructions. First and foremost, and this will become more important as the heating season comes around, running a vaporizer or a humidifier in the bedroom each night with the door closed, allowing the humidity level to rise during those 7 or 8 hours of sleep, and it provides a remarkable refreshment and rejuvenation of a dried nasal and bronchial mucus layer. Wearing masks. Masks are a help because we breathe the air from the mask that's somewhat warm and humidified. That's another plus. Anyone who leaves the house when it's cold outside should have a scarf over their nose and mouth. Absolutely, it's just the simplest thing to do, and it really helps to maintain that first line of immune defense.
We've been talking about technical developments with respect to medicine, but how about with respect to the communication of this kind of information to people? Are you getting involved with, like, for instance, YouTube?
Yes, I've got 2 videos on YouTube right now, and I'm reworking and hoping as I learn more about how people like to receive information in social media. I'm hoping that before the heating season, we can take a running start and get this message out to everybody.
It would be good if there was some mechanism where people could call in with routine questions, virtual questions. They didn't have to actually come to the office to.
Yes, you're absolutely right. And I think between now and the publication of this piece, I hope that I can find a mechanism to gather comments and questions from our audience today. But
So,
beyond that, we've got to get onto into the social media with this message as well.
what is your advice with respect to nutritional or supplements that people take when it comes to things like vitamins and protein supplements? How do you view that for
Right.
lifestyle effects?
You know, it's a challenge scientifically when studying that topic to tease out the difference between association or causation. But I think we've watched vitamin D and vitamin C long enough to be able to advise patients who are interested in optimizing their immune defense. Vitamin D and daily vitamin C, I think, have shown over time a benefit.
Well, at the risk of offending people at this terrible time, I have to ask you this question anyway, even if it's offensive, so I apologize, but I have to ask, what has been the most interesting thing about your treatment of people during this COVID crisis? Maybe interesting is kind of tacky, but I think I'd like to know.
Now, one of the interesting things, and the reason I wanted to particularly address those individuals who are locked down, those individuals who are taking all the logical preventive measures, still there's a residual anxiety, isn't there? And I think that individuals who go up to excessive, as I said, excessive hand washing, and going to great lengths of prevention in settings where it's really not necessary. Walking outside. This virus doesn't travel very far in the air. It, despite some isolated reports of virus traveling over 20 feet, the reality is it doesn't stay airborne very long, and it doesn't pass by a 6-foot perimeter around that person. So when there's a distance, I think people can let themselves feel that sense of reassurance and let that replace the chronic anxiety.
Has there been an impact on the treatment of people who have other conditions that need medical attention? Do they feel inhibited about coming in for treatment? Are they inhibited from coming in for treatment?
Yeah, I will tell you from observing our office population during the initial few days of the lockdown. Everybody was just too apprehensive to really leave, and so they wouldn't make the appointments. But that's one thing that we've observed, is that even as we turn our attention to the virus, there are other health issues that remain. And so,
speaking of remain, what advice do you have for children who might want to get into medicine, in either as a doctor or some other clinician?
Yes. Well, first thing I'd like to say to every young person, welcome. Come on in. Healthcare is going to be it's going to provide a secure and fulfilling work life for so many people going forward. And I would urge young people to find a mentor, find a setting in which they can expose themselves to the healthcare environment. Find an area that seems comfortable and attractive to them, and then go for it. Go for it. We need you.
There are a plethora of careers.
A plethora of careers.
There are a large number of careers. Well, listen, on behalf of Forum 360, I want to thank you, Dr. John Gibbon, pulmonary specialist from Stark County Respiratory and Allergy Center, and an expert in the field of COVID-19, talking today about the COVID-19 virus and what people can do to survive now and this winter. On behalf of Forum 360, I'm Sally Henning.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.